Good morning, children. Yesterday, in the last class, we were started the discussion with respect to the STDs, isn't it? Because this is actually a very important topic. Repeatedly, they will ask the number of questions based on this topic. That's why we will discuss briefly about the STDs. Then we will continue towards the further topics. Okay, fine. So, as we were discussed in the last class, what is the meaning of the STD? That is sexually transmitted diseases. Short form, we will call it as STDs. The diseases transmitted through sexual intercourses are called sexually transmitted diseases or infectious, or we can also say the sexually transmitted infections. They are generally venereal diseases. Why it is? Because it leads to death also. Okay, or we can also say the reproductive tract infections due to the sexual intercourses. That's why they are called sexually transmitted diseases. And we were also discussed about some of the examples with respect to the STDs: the gonorrhea, syphilis, genital herpes, chlamydiasis, genital warts, trichomoniasis, hepatitis, and AIDS. Okay, so here are some of the diagrams which is given in the below. You can identify these are all the symptoms. Generally, we can identify in the infected persons also. Yes, did you got it? Fine. So then after that, in the last class also we were discussed how it is generally the mode of transmissions, isn't it? As I said, the hepatitis B and HIV are also transmitted through the sexual intercourses only. That means the mode of transmission, the sexual contact with infected person, the sharing of injections, needles, surgical instruments with infected persons, and also the transfusion of contaminated blood, especially in the earlier whenever there will be emergency. So these are all the number of cases happens without the proper checking of the blood. If they transfuses or they will be given to the any person, if the person is suffering from any type of these type of the STDs, those will be easily transmitted to the the healthy persons. Yeah. Here, STDs can also be transmitted from infected mother to that is growing fetus, isn't it? But remember, except hepatitis B, genital herpes, and HIV, other diseases are commonly, especially if they are able to identify or diagnose in the early stages, those diseases are completely curable. But it should be detected early, and if they will be treated in the proper manner. Okay. And here, how can we identify? Yes, these are all the STDs only. Based on the symptoms, the common symptoms of the STDs, so that we can identify, yes, these are all nothing but STDs only. That is itching. Generally, it is also, we can also say, the profuse itching, especially at the region of the reproductive, the tract or genital tract. Then the fluid discharge, a slight pain, swelling in the genital region. Okay, and but remember, infected females may often be asymptomatic. That is nothing but in the beginning they will not show any symptoms. That is asymptomatic. Okay, so that hence they may remain undetected for a long time, especially if the females, if they are suffering from STDs. So you must have heard about number of cases, especially in case of the prostitutes. They may become super spreaders of the STDs also. Okay, and so but The options are less significant symptoms in the early stages of the infection, and the social stigma attached to the STDs deter the infected person from going for timely detection and proper treatment. So that if it will be given, that means in the beginning stages only, surely it can be curable. Okay, yes. And these STDs, this could lead to the complications later, which include pelvic inflammatory diseases also. It is short form known as PID, and if it will be not given proper treatment, which maybe leads to the repeated abortions. That means still the both, so that is ectopic pregnancies. In CT and competitive, sometimes they will ask what is ectopic pregnancies. Note down a pregnancy in which the fetus develops outside the uterus, typically in a fallopian tube. It is also known as ectopic pregnancy. Okay, are you getting? See, generally the pregnancies should be inside the uterus, isn't it? But in case of this, the STDs, if the person, the female or if she is suffering from the STDs, the pregnancy in which the fetus develops outside the uterus. Okay, and typically in a fallopian tube also. So in the further cases it will become worse or worst, so that it may lead to the problematic for both mother and growing fetus also. Then the infertility or even cancer of the reproductive tract. Okay, so these are some of the common symptoms we can identify in case of the STDs. Did you got it? Yes. And how to prevent? Okay, the preventive measures. There is a proverb in English, prevention is better than cure, isn't it? So that's why this chapters and all, they have given the complete information about the reproductive health, isn't it? How to prevent these are all things. Avoid sex with unknown person or especially multiple partners. Always use condoms during intercourse or coitus. Okay, in case of doubt, so that means not only in case of the sexual intercourses, there are a number of cases. If they would have taken the blood in emergency cases without proper checking, if they would have used any generally grooming in kit like blades and all, so one must consult a qualified doctor without delay. Okay, and note, as I said, there is no need to feel fear about all these things except for hepatitis B, genital herpes and HIV infections. Other STDs are completely curable, but it should be detected early and treated properly. Okay, and see, all the persons are vulnerable to STDs. So these are very high among the persons at the age group between, that is 15 to 24 years. See why this is actually mentioned. So in this age, especially number of people, they want to try in a different manner. So because of some experimental problems, so they may get this type of the infections also. Okay, so these are all about the STDs. The next topic we will discuss, that is infertility. Infertility, it is also commonly known as sterility. How can you define infertility or sterility? It is the inability to produce a child, or you can also say it is an inability to conceive pregnancy, or to conceive is called, that is infertility. You got it? How can you define infertility or sterility? It is the inability to conceive or produce children But remember, even after 2 years of unprotected sexual cohabitation, so then only it will be considered as infertility. Okay, so there are some people, they will think that if they are undergoing, that means protected sex means, so that is not a infertility. Okay, so but even though they are undergoing sex, that is unprotectedly, okay, after 2 years also, if they are not able to bear the children, then that condition is considered as infertility or sterility. Okay, so the reason for this, I mean the infertility is could be many. Okay, so all the times we cannot say as single reason, so that may be a physical problems. Sometimes those, both the persons, or sometimes one of the a partner, they may be facing the physical problems, and congenital of a particular person problem, and the diseases. There will be different type of the diseases, drugs. Sometimes they may be taking regular drugs for different aspects, so that may be also leads to the problems to the infertility. Then especially immunological problems or even the psychological. Okay, you must have heard about the psychosomatic disorders. Sometimes they will be thinking always in the negative manner. We will not get children, we will not get children, like that. So that because of some psychological reasons also, it may be leads to the psychosomatic disorders. So that is also reason for the infertility. Okay, it is proved also. Okay, then, and here hence these couples could be assisted to have their own child through the certain special techniques is called assisted reproductive technologies, that is commonly known as ART. Okay, so let me to tell you what are the common defects it can be identified in case of the males or sometimes in case of the females. Okay, so sometimes in case of what are the defects, generally it can be identified in case of male, the deficiency in the gonadotropin releasing hormones, then sometimes undescended testes, defected in the penis or abnormal growths, the blockage of the sperm ducts, azoospermia, that is a non-motility of the sperms, and oligospermia, less sperm production, or even STDs also reasons in case of the males. Because of all these defects in case of the males, they may be not able to get the children. Okay, in case of the females, sometimes what are the defects we can identify in case of the females? Okay, so the deficiency in gonadotropins, defective vagina, and even defective uterus, sometimes the blockage of uterine tube, and lack of ovulation, tumors in the uterus, improper development of uterus. These are all some of the defects or reason for the infertility in case of the females. Okay, so in these conditions generally, so these disorders can be treated in infertility clinic using assisted reproductive technologies. Okay, yes. So as I said, the assisted reproductive technologies, short form, it is known as ART. Okay, the technologies used to correct the infertility problems, they are known as assisted reproductive technologies. Okay, some of the technologies here they have given. See, remember, so that is IVF, ET. You must have heard about the common terminology, test tube baby, isn't it? Don't think that test tube baby means they will grow inside the test tube. Okay, so there are a number of people they will think that test tube baby means completely it is grown in test tube. No, not like that. I will discuss. I will tell you how it will be. So IVF means in vitro fertilization and embryo transfer. It is under controlled condition. They will perform the fertilization. Okay, then they will transfer the embryo. So then there is another one is gift, gamete intrafallopian transfer. And there is another one, here it is not given, remember, ZIFT, ZIFT, a zygote intrafallopian transfer, and post peritoneal oocyte and sperm transfer. There is another technology, DOST, DOST, direct oocyte and sperm transfer. Okay, then the another one is ICSI, that is intracytoplasmic sperm injection. It is also known as artificial insemination. Okay, so let us discuss all these things one by one. Okay, yeah. So as I said, here the first case, IVF, ET, in vitro fertilization and embryo transfer. See, you should note down what are the steps generally. Here, the left side we have given the diagrammatic representation in the slide, how they will conduct the IVF. Okay, the woman in the beginning is treated with FSH, follicle stimulating hormone, to induce the multiple ovulation. Okay, so that which results in the release of several ova at a time instead of one. Okay, so this is also called superovulation. Remember, they will ask for 1 mark question. What is superovulation? The woman is treated with FSH to induce multiple ovulation, which results in the release of the several ova at a time instead of one. This is called superovulation. This is the first step. Then, next step, a small incision is made near the, that is, umbilicus, and the ova are aspired with the help of laparoscope. Okay, so that they can identify the suitable or healthy ova. Okay, fine. Then what they will do next? The ova are incubated for few days in a petri dish, that is controlled condition, containing suitable medium. So that's why they have given the terminology in vitro, under controlled condition or under laboratory condition. Okay. Meanwhile, the semen is collected from the donor or from the sperm bag and kept in a suitable medium. See, this is generally, especially, so this, the semen is collected from the male parent, but generally, in out of condition and all, they will collect the semen from the healthy donor or from the sperm banks, and it is kept in suitable medium. Okay, yeah, you will not believe. So in our India, generally we will find a blood bank, right? So there are some countries like the population is very less, like in Australia. So they have, installed a semen bank also. Okay, and sometimes they will purchase and they will get the good amount also for that purpose. Okay, so these are some of the interesting topics. Yes, the incubated ova and the sperms are mixed in a test tube containing suitable medium for fertilization. Did you got it? See how they will conduct. The incubated ova and the sperms are mixed in the test tube containing suitable medium for fertilization. So this is just like providing artificial environment. Okay, so that the sperms can easily fertilizes with the ova. Okay, then, and within 24 hours, the ova are fertilized with the sperm in a test tube. So this type of external fertilization that takes place outside the body of the mother, but in the test tube, is called in vitro fertilization. As I said in the beginning, what is in vitro fertilization here? So this type of external fertilization that takes place outside the body of the mother, but in the test tube, is called in vitro fertilization. Now, the fertilized ova or zygote are then transferred into another suitable medium in which they undergo cleavage. When the fertilized ova reach 8 cell are 16 cell stages. 2 or 3 of them are transformed into the uterus of the same female or surrogate mother for implantation and for further development. Okay, so this procedure is called embryo transfer. Okay, now the embryo which gets implanted develops into a fetus and the other degenerates. The implanted embryo undergoes growth and developmental sequences, and later the baby is delivered after completing the gestation period, that is pregnancy. Okay, so that's why this technique is generally considered as a test tube baby. The baby born out of such technique is called test tube baby. Okay, and the baby produced by conceiving in a cultured dish and nourishing in the uterus is also called test tube baby. Okay, remember there are two types of embryo transfer, that is a ZIFT and IUT. ZIFT, zygote intrafallopian transfer. Okay, so in this technique, that is ZIFT, after in the in vitro fertilization, the zygotes are transferred into the fallopian tube. The advantage of the ZIFT is that the fertilization is surely, that is confirmed. Then another one is IUT, intrauterine transfer. Okay, so it is also known as, let us discuss one by one. That is in vitro fertilization, as I said, IVF, test tube baby program, embryo transfer. Okay, so short form, that is ZIFT, zygote intrafallopian transfer. That is transfer of zygote or early embryos with up to the 8 blastomere stage. They will directly transfer into the fallopian tube. Okay, so then in case of IUT, intrauterine transfer, that is transfer of embryos with more than 8 blastomere into the uterus. So this one specifically they will ask in the competitive, remember. Okay, how many number of cell stage, 8 blastomere stage, 16 blastomere, like that they will ask. Okay, then, and the embryos formed by in vitro fertilization, that is fertilization within the female, is also used for such transfer to assist those females who cannot conceive. Okay, so nowadays, so this technique is very, great in demand. Yes, there is another technique which comes under all gift. So sometimes in 1 mark questions also they will ask expand gift, ZIFT, post, those like that. So in case of the odd, if they ask us to expand the gift, means it is gamete intrafallopian transfer. Okay, in this method the sperms and ova are collected or introduced into the upper part of the fallopian tube where the fertilization takes place. Okay, so that's what I said in the beginning also, the transfer of an ovum from a donor into the fallopian tube of another female who cannot produce ovum. Okay, so in such a cases we use this technique, but can provide the suitable environment for the fertilization and development, then only so this is possible. Okay, here the left side they have given how they will collect the ova from the donors by using, that is, catheter. Okay, so next one is, that is short form ICSI, intracytoplasmic sperm injection. Okay, see here in this case generally how they will conduct this process. So this is also one of the technique comes under the art. It is a specialized procedure to form a embryo in the laboratory, in which the sperm is directly injected into the ovum. Okay, and here infertility cases either due to the inability of the male partner due to inseminate the female or due to the very low sperm count occurs in the ejaculations. Okay, so and generally this could be corrected by artificial insemination. Okay, are you getting? So that is ICSI when will be uses a laboratory procedure in which a single sperm for male partner is injected directly into an egg from the female partner. After the fertilization, the embryo is implanted into the woman's uterus. Okay, so this is generally when we use this technique, the male partner generally may be producing the numerous number of sperms, but the sperm's head may be not containing the that is lytic enzymes, so that it cannot be penetrating. That sperms may not able to penetrate in the egg or the ovum. In such cases, we use these techniques. Remember, so this they will ask in the competitive also. Okay, here the left side they have given. Observe one by one. Yes. Okay. And as I said here, the in case of this only, so generally we use the artificial insemination technique. What is this artificial insemination AI technique? So generally you must have heard about the especially in rural backgrounds, they will be telling that is seven giving. There is not seven giving, it is actually seven. Okay, so that is artificial insemination or artificial semen giving technique. In this technique, what they will do, the semen is collected from husband, or as I said in the beginning, in case of especially in foreign and they will collect the semen from donors also. Okay, so artificially increased into the vagina or the uterus of the female reproductive tract. Then the artificial insemination into uterus is also known as intrauterine insemination, IUI. Okay, so through options are many. Remember, so that is nothing but the technique. So this technique is useful for the male partner having inability to inseminate female or low sperm counts. Okay, sometimes, so generally the sums will be very less. Okay, so in such a cases this technique is very effective. And here there is a technique, instead of going for the all these techniques, so because these are all techniques, they are costly, and so I will tell you at last why, what are the problems or limitations of the art. So instead of going for all these techniques, they can consider the surrogacy also. In case of surrogacy, a woman surrogate mother bears a child for a couple unable to produce children because of the wife is infertile or unable to carry. They may be physically facing some different type of the problems. They may be not able to have having that much of capability to carry. Then they can undergo this case. They can adopt the surrogacy. The surrogate is impregnated through the artificial insemination or implantation of an embryo produced by IVF. Okay, so this is one of the best technique, so that surely they will get the children also. So even though the art is having the lot of advantages, still it is having some of the that is problems. Okay, so this can be asked as 1 mark question or 2 marks also. What are the problems? Okay, or drawbacks of the art, like that. It requires high precision handling by specialized professionals and expensive instrumentation. Remember, okay, so in especially cosmopolitan cities, they will charge lakhs together money for this process and all. Why? Because it requires high precision handling by specialized professionals only. Not all the common people they cannot handle. They should be professionally trained for this purpose. Okay, and the expensive instrumentation, whatever they use as the instrumentation during these techniques, they are sometimes lax together, sometimes cross together. Okay, then because to install the complete in instrumentations, so that's right. There are, therefore these facilities are available only in the few centers. That's what I said. This is restricted in cosmopolitan cities. It is not available in the rural areas and all. And finally, emotional, religious and social problems. So emotionally, they will think that the baby may be grown in some other woman. They may always think that it is not grown in my stomach or my fetus. Okay. And religiously, some people they will not ready to agree all these things, especially in our country. Then the social problems. If the other people come to know they got the children by these techniques, they will talk in a different manner. So these are some of the problems of the art. Okay. Yeah. So instead of all these things, there is a best idea. There are a number of children. They are facing the problems in the society. So because they may be become generally. Generally they may be feeling guilty without having children, isn't it? Instead of that one, if they take adoption, there is a legal adoption nowadays. In generally, if they take as a the adoption, sometimes they will face the legal issues in future. Instead of that one, they can take legal adoption is one of the best methods for the couples looking for parentalhood, and also they can give life for one child. Okay, so these are all with respect to this chapter. So there is nothing but reproductive health. Okay, so in this chapter we will discuss the number of aspects, isn't it? From the beginning we will discuss about that is nothing but the reproductive health programs and strategies, so which is including overpopulation, sex education, isn't it, and all those things. And also we will discuss about the population explosion and birth control programs, that is contraceptive methods, temporary methods, permanent methods, isn't it? And also we will discuss about the MTP, medical termination of pregnancy, STDs, and also infertility art programs. So these are all with respect to the chapter, that is reproductive health. Okay, so let it be. So next class we will continue with respect to the competitive part. Thank you. Have a nice day.